Hiya. So, if you'd just like to introduce yourself to the students, give your job title and a bit about the role that you do at the moment.
So my name's Bev Harwood. I'm the clinical nurse specialist for emergency surgical admissions at Kingsmill Hospital. So this was a new post when I joined back in July 2019. So obviously so nobody had ever done the role before. So it was quite a challenge, sort of trying to understand obviously what the consultants wanted from me, what the service needs were for patients that were coming in under the emergency surgery team. So the emergency surgery admissions are tends to be people that present with abdominal pain, such as appendicitis, gallstones, so obviously cholecystitis, abscesses, and anyone that's probably had surgery and then developed a complication from that surgery.
Okay.
Um, yeah, and also the challenge was for me as well. So I was actually new to Kingsmill Hospital and Sherwood Forest Hospital's NHS Trust, which I will say is an absolutely lovely place to work, and I'm glad I had the opportunity to come and work here.
Can you give me a bit more information about Kingsmill Hospital and that kind of
So, King-
organisation?
so the history of Kingsmill, as far as I've been made to believe, is so it was originally going back to the Second World War. It was actually an American military hospital. And actually, if you come into the main entrance, they've got sort of a display cabinet with an old uniform in, and there's quite a lot of history, sort of, sort of memorabilia that people can look at, which is quite interesting for if you're coming to visit the hospital. So Kingsmill Hospital is part of Sherwood Forest Hospital's NHS Trust. So within that trust, we have Kingsmill Hospital, which is like the acute general hospital, which has the emergency department. We also have Newark Hospital, which is more of a rehab hospital and sort of an elective hospital. They will do sort of day case and planned operations. And we also have Mansfield Community Hospital, which again is a rehab hospital. Obviously, we employ over 1,000 people, and obviously within those hospitals, there's a variety of different roles which people are employed in. Again, with Kingsmill itself, I'm sure the students have heard of the Care Quality Commission, which is the CQC, which go around inspecting hospitals, GP practices, nursing homes. And I'm proud to say that I work in an organisation that was voted outstanding
Wow.
this year, which is quite emotional, really. So, yeah, so it's been an achievement for them because I believe sort of back in, so I think it was 2016. And again, I don't know if the students remember or they learn about the Francis report, which was where there was a sort of the incident at a hospital in Stafford. And from that, we sort of, the Lord Francis did a report, and all these reforms were brought in to improve things. And then also on top of that, they had the Keogh report, which looked at sort of sort of large hospital death rates. And unfortunately, Kingsmill came into that category. And were unfortunately back at that time, even though the staff worked really hard, were voted as of requiring improvement. So in actually a 4-year period to go from requiring improvement to outstanding, which is the highest you can be rated by the CQC. So that's absolutely amazing for them.
Wow. Yeah, that's pretty impressive.
And it is, as somebody that's worked here and that worked at a big teaching hospital before they came here, the staff do work really well together. Teamwork is really evident in this trust.
So, what other roles are there within the hospital? I guess there are loads and loads, but what are the general kind of things that people tend to do?
So obviously we have nurses, as everyone expects. You have obviously healthcare assistants, which do a lot of nursing type roles. So they will do blood pressures, obviously help with washes. They will do some of the admission paperwork. Um, and again, some of them actually do dressing. Some go on to do further training, so they can take bloods, put the cannulas in. So if somebody has a drip, so that's the little needle that obviously people can be trained to put in. Obviously, we have the porters, we have the domestics, we have the ward hostesses who go and give the patient meals out. Obviously, we've got shops within the hospital, so you have people that are employed in those shops. You've got people, radiographers who take x-rays. You've got physiotherapists, you've got physiotherapy assistants, you've got occupational therapy assistants. We've also got people who were nurses who are actually employed on the educational side. So they're involved a lot with our training. You've got medical secretaries, you've got waiting list coordinators, so they look at sort of obviously when people are listed for an operation, they ensure that the correct patients are put onto obviously the correct operating lists. The list is absolutely endless. I could go on forever. We have people that work in the laboratories. So obviously you have doctors, obviously. So obviously what can happen here, so some people can be sort of a medical person working within the laboratory, as i.e. a qualified doctor, but actually you can have assistants that work in the laboratory. So everybody's all different grades, but we all work together. I'm just trying to see if I forgot. So at the moment, obviously because of COVID, which is a very topical thing, we have quite a lot of staff that are employed to be our, what we call swab team.
Okay.
So anybody that comes into the hospital or that is admitted into the hospital is actually given a COVID swab. So I know that obviously this is quite a topical thing, and people, you know, probably want to know what happens. So obviously we don't know anybody's status until we get that swab result back, but hopefully we do get it back sort of within 6 hours. And that just defines really a sort of management, but safety from the nursing point of view, as to obviously to ensure that we're wearing the correct equipment when we see to these patients.
Right, okay. So what does a typical day look like for you? Let's
So
go.
my day, my day. So obviously, as I've said, you know, this was quite a new role. So it was sort of kind of establishing, obviously, what quality, you know, what skills I already had to bring to this post. And then, you know, where do we go from here? How do we expand on that? So currently, a normal day for me is I sort of get into my office about 7:45, literally just sort of gather all my belongings and ward round for the anyone that was admitted overnight. Starts at 8 o'clock. So on that ward round will be myself, obviously the consultant, and sort of different grades of doctors. So we usually start on ward 11, which is the surgical admissions ward, and then literally it's just sort of a handover for the consultant, because he may not have met these patients. It may have been a senior doctor that saw them overnight. Obviously, just to check blood results, see what the next sort of stage of their care is. Do we need to request any investigations for them? Obviously, I've done some extra training, so I can request things such as ultrasound scans, CT scans, and the MRI scans. And also, do we need to request extra blood tests? Sometimes we have to, obviously, we've looked at what somebody's presented with. We've looked at the information we've got from scans, from their bloods. We may need to send those patients to theatre. So again, I will sort of make phone calls, liaise with theatre to check these patients are on the operating list, and I will then contact the anaesthetist, because obviously people need, if we're going to give you an anaesthetic, we need to just assess your health and that you're fit enough for this anaesthetic. The other going back to COVID, so obviously the thing we need to chase up for any patient that we think's on a theatre list, obviously because of staff safety, we then, you know, need to ensure whether they're a negative or positive. So what if a patient isn't consented for theatre, again, I've done extra training, so I will go and talk to these patients about their operation, what it's going to involve, and obviously, you know, give them information leaflets about it, and then answer any questions they might have about that operation. I've spent, you know, a lot of my career was spent as a theatre nurse, so obviously I've got a lot of knowledge there about the operations that they're going to have. And then obviously just talk to them a little bit about their aftercare after their operation. So that's takes up most of my morning. Then I have sort of about an hour of office time where I will keep spreadsheets of any admission that we've had, anybody a readmission, obviously to look at what our numbers are really, and what can we do to make it better. I have just started, or I will be starting as of next week, my own clinic. So between 12 and 1 o'clock in the day, I will see up to 4 patients, and they will be, so some of our patients go home with drains in, whether they've had a planned operation or an emergency one. And sometimes the consultants, you know, just want them to come back for a review. And so you have to think, does a consultant actually need to do that, or is that something I can do, which it is. And we'll look at, does this drain need to stay in, or actually can it come out today? Some people might have wound complications after surgery. So again, I'll just assess that wound, see how they're doing, and then feed back to the consultants. Some of our patients, sort of around April and May time, when it was obviously the first wave of COVID, we had to sort of manage people differently. So somebody with gallstones, so that's where you get stones in your gallbladder, we couldn't always, it wasn't safe to do surgery at that time. And sometimes people aren't fit enough for the surgery. So sometimes they have a special drain put in. So a lot of these patients do tend to come back to me, and I'll teach them how to flush these drains if they've got any complications with them. And then another part of my day is obviously telephone sort of conversations with patients, just to see how they're doing. And again, and it's just sort of like looking at really, you know, what we can do to make the service better, you know, how I can make improvements for the service. Yeah. And so I have done some teaching sessions as well with the ward staff. So if we've had sort of a problem area where somebody's not really known how to care for a certain patient, I've been asked to do a teaching session about that certain sort of illness with somebody. So and that, you know, and that's an aspect of my role that I enjoy doing as well. So
did you train to teach people, or has that element of your job just come with your experience?
So I did. So as a nurse, you can actually do, once you've done your basic training and you're qualified, you can actually, you are encouraged to sort of do this mentor training. So although I haven't done an official teaching training, I've sort of done mentorship, but obviously over the years, and I've worked in lots of different places, but obviously I've sort of learned a lot about different conditions, and it's something that I'm really interested in, especially on the surgical side, you know, about the sort of the appendicitis, the gallbladders, pancreatitis, and how these patients present, and actually, you know, looking at the best practices to look after these people so we get the best outcomes for them.
So that leads quite nicely. What path did you actually take to get to where you are now?
So what did I take? So do you want me to go back to when I was at school? So
for this, yeah.
Right. So when I was at school, things were slightly different. So I sort of, within my O levels, I did biology, chemistry, and physics, and obviously maths, English, geography. But that's because I enjoyed the sciences. And even though when I was at school, I still wasn't quite sure which way I wanted to go. I think by the time I was in my final year, I was quite looking into food technology, strangely. And then I went to sixth form college, where I was doing chemistry, biology, and I think I did physics, and I was doing home economics more from that food technology point of view. And again, as I say, things were quite different. So I left sixth form college after a year and then went to technical college, just because I thought that the subjects they were offering me were more the kind of thing I wanted to do. And it was while I was at technical college, I started doing a pre-nursing course. And so that actually took me out to a hospital up north, is Wrightington Hospital, 1 or 2 days a week, to an orthopaedic hospital. And actually, from that moment, I thought, I'm really enjoying this. And that was just getting to know, you know, I was just chatting to the patients. They'd take me when they were doing dressings. And then sort of, so I actually never did any A levels, because when I started nursing, I sort of decided after that year, when I was 18, that actually, no, I do want to be a nurse now. Things were very different then, because it wasn't a degree profession at the time. So what you did was you actually applied to the hospital, to the School of Nursing, which was actually based at the hospital. And then obviously I was lucky enough to get on my nurse training in Warrington Hospital in 1987. And then from then, I've never looked back, to be honest. So, as I said, very different, not a degree profession, but it was a very hands-on training at that time. So you would sort of initially spend 6 weeks within the school, and then you'd go out and do ward placements for 4 months at a time. Then you'd go back into school for 2 weeks consolidation, and then you'd have like a week or two's holiday, and then it would all start again. So you'd have your learning, do your practical element of it, and then back for your consolidation. So over 3.5 years, that took us through medical wards, surgical wards, the specialty wards such as orthopedics, gynecology. We spent 2 months doing psychiatry, 2 months within theatres. We had a placement of 4 months of community, where we went, sort of did occupational health type things, spent time with district nurses, practice nurses, the ambulance service. We didn't do the fire service, so that was actually quite interesting. And then, so back in those days, we sort of did what we called the state finals. So again, it wasn't this continuing sort of assessment. It was literally, you had your 3.5 years. At the end of it was a day of exams, basically. So you had 15 short answer questions. Then you had 3 sort of essays that you had to write on how would you base this patient's care in a needs-based approach, things like that. And then we did have to do like a research critique. So obviously, as I know from the students of today, that's very different to what they did. Yeah. But I feel that our training back then was very much more a sort of medical training, because we had to know about conditions and we had to know about treatment. So from then, so once I qualified, I decided that I wanted to go and work in the operating department, because I thought the operating department of surgery was extremely interesting. And so I went to work in London. I'd qualified in a hospital up north, and I went to work at a great big teaching hospital in London, which was a bit of a culture shock to start with, because I'd come from a hospital that was relatively new to go and work to this one that was like so old, and I was like, oh no, what have I gone to? And that was interesting, but I think because my family were up north, I sort of, when I was young and I missed them, so I moved back up north to Manchester then, still within theatres. During that time within nursing as well, we used to have these courses that were called English National Board courses. And so if you wanted to work in a specialised area like theatres, the emergency department, intensive care, that they used to encourage you to do these courses, which are about 6 months or 12 months, to get this sort of extra certificate, and that would help you get promotion. So obviously, so in those days we had, so a newly qualified staff nurse would be a D grade, and then if you'd done these extra qualifications, you were then classed as sort of a senior staff nurse, and you were being given an E grade. That all changed a few years ago, and we're now banded in numbers. So there's no really any differentiation now between senior and junior staff nurse. So for the first 23 years of my career, I was mainly a theatre nurse. So that meant, obviously, I was trained to sort of hand instruments for different operations to surgeons. But it's obviously the main focus of it is the patient safety, making sure that you've got all the equipment that you need. Is that patient safe on the table? Obviously ensuring that you're supporting your staff as well as them supporting you, and obviously you're supporting the anaesthetist and the surgeon. Sometimes I'd work in the recovery department, so that was looking after the patients after they'd had their operation and before you send them back to the ward, just ensuring that obviously they are coming around after their anaesthetic. Throughout that 23 years, although I enjoyed theatres, I did miss sort of ward-based nursing. So sort of now and again, I would do an extra shift on my days off on the wards, just to sort of keep my skills updated. Yeah. During that first 23 years as well, I worked as a nurse first assistant. So again, that was extra training for me. So I was then able to assist at an operation for ladies that were having either cesarean sections, obviously, so somebody can't have a baby normally, and they cut them, or any gynecological operations, and I was trained to sew up the skin wounds afterwards, which was quite nerve-wracking when you do your first one, but apparently I did a very neat job. So, so that takes me up to 2001. So, between 97 and 2001, I went to work in the Channel Islands in Jersey. So I'm sure some of the students have probably heard of Jersey and the Channel Islands. So that was a bit like a 4-year sort of holiday for me, really. I never sort of, I think at some points I thought, I want to go and work in Saudi Arabia, I want to go and work in America. But actually for me, going to work in Jersey was far enough, because it was near to get back from my family. And then obviously I came back to the NHS in 2001, obviously worked as the nurse first assistant. And then I just worked in a hospital near my family for a while. And then I came to Nottingham in 2004. initially working at Queen's Medical Centre within their operating department. And then, as I say, when I got to sort of 23 years as a theatre nurse, I thought, I really need to, do something different now. So within nursing, that just shows you can make a change. You don't have to stay in one speciality all the time. If you sort of get an insight into another area and think, oh, that's what I really want to do, then you can do it. The opportunities are there. So I went to work on a surgical assessment ward, which is quite similar to the job I do now, but obviously I was a ward nurse at that time. So that was obviously looking after patients that get admitted before they're transferred to a longer stay ward. From there, I then got promotion to sort of a specialist nurse. So specialist nurses can be paid equivalent to either a deputy ward manager or a sort of ward leader. So we're sort of band 6s or band 7s as specialist nurses. So that was within gynecology, and that was looking after ladies in the early pregnancy unit. And so obviously offering a lot of support for them and sort of emergency gynecology admissions. That was a role to cover maternity leave. So as the cover was due to end, I then got a job as a colorectal nurse practitioner, which was an absolutely job that I absolutely adored. So for 4 years, during that 4 years, I was trained to do my own nurse-led clinics. The patients that we saw were patients of a certain age that present with certain things, and the GPs refer them to the hospital on what we call a 2-week wait pathway, because what we want to do is exclude bowel cancer in those patients.
Okay.
So the service that the colorectal nurse practitioners offered was literally, rather than actually somebody wait to come to a hospital appointment, the GPs would refer into the colorectal nurse practitioner team, and we would see from those patients who could we do a telephone assessment on, and book them directly for an investigation, or actually who do we need to see in clinic, or who actually needs to see a consultant. Right. So that was actually quite a busy job. The other aspect of my role at that time was obviously looking at people that came in for their bowel cancer operations, and actually what can we do to make their stay better, because hospitals aren't safe places to be in. We're better to sort of get you up and moving and get you home to recover. And during my time doing that job, we actually increased our admission rates by 50% on the wards of people going home sort of in an idealistic time frame. But then after 4 years, because it was the same speciality all the time, I just thought I need to do something different. And I'd worked in the same organisation for 15 years at that point, and I just thought I feel like the need for a change. And actually this post that I'm in now was advertised, I think, in March last year. And because actually it was every aspect of general surgery, so we've got colorectal, which is bowels, hepatobiliary, which is obviously liver, gallbladder, upper GI, which we class as the stomach and the esophagus. Again, it's like the abscesses, the hernias, that type of thing. And the fact that, for me, it was a way I could consolidate all this experience I'd gained over the last 33 years, and actually look to make a difference somewhere. And actually, strangely, the consultants that I worked for, I had actually worked with over the years when they were junior doctors. So it's quite nice. Yeah, so as I keep saying to my consultant, thank you for giving me the opportunity to come and work here. And every day is like a totally different day. So
would you say that it's been easier or harder than you expected in terms of moving to different areas within nursing?
So I think initially, so back in the 90s, which I know people are going to laugh at now, especially the students of today, when they hear about how many, we've got this big shortage of nurses. In the 90s, it was quite a different story. So up north, it was actually quite difficult to get jobs up north at that time. Which I know people just think, oh no, what happened? So actually, if you were lucky to have a job up north, you literally sort of stayed in it, and there wasn't much scope for movement. So I stayed up north, but I managed to get different jobs in different hospitals. But it was still always theatre or recovery. And at that point, it was a bit, so at one point I had this interest in going to work in a renal unit for patients that have dialysis because their kidneys aren't working properly. But actually it was quite difficult. And actually I remember somebody at an interview saying to me, well, we don't want you to lose your theatre skills. which actually but I think for me, that was the only time that I was like sort of thinking, but actually I don't want to do this anymore. I want to go and do something else. Obviously I found that it is a lot easier for movement, because obviously, yes, there are those vacancies. And again, you sort of, and if people don't want to work full time now, or you're a bit unsure, you don't want to work in the same place, we do have, so here we have a nurse bank, or so that's where people just do ad hoc shifts. I will tend to do an ad hoc shift on a Saturday night, or people can join nursing agencies. But then again, for me, I like the stability of working in the NHS.
Yeah.
I know we shouldn't talk about pensions already, but actually, if you work for the NHS, you join the superannuation pension scheme, which is something. So a lot of nurses my age are able to retire at 55.
That's not bad, is it?
Because they start. Yeah. But because what happened was, because we started working at the age of 18 and were paid by the School of Nursing, you actually started paying your pension at that age. So that's why you sort of see some people saying, "Oh, I'm 55, I've retired," but they've actually either gone back part-time or what we call retire and return.
Right, okay. So in terms of pursuing a career in your kind of field, have you got any advice that you can give to the students? Any major tips?
So I would say, so obviously, if you get the opportunity, obviously, I don't know what courses you do out there now. If you get the opportunity to sort of do insight visits, I'd be happy for someone to come and spend a day with me, shadow me, follow me around. If you get the opportunity, it isn't Holby City or casualty. But if you get the opportunity to have an insight visit onto a ward, even a nursing home, I worked in a nursing home for a little bit, you're sort of doing the odd shift. Get out of it. If you don't get the grades first time round, don't worry, because we do access courses. The other thing we have now is what we call a nursing associate roles. So that's sort of a role between a healthcare assistant and a qualified nurse. So obviously it's a sort of a bit of a grey area for me, because I don't know that much about them, but actually people will go off and they're classed as trainee nursing associates. You can then be put on the Nursing Midwifery Council register, and actually a trainee or a nursing associate, once you're qualified, is a band 4, and they are actually able to do quite a lot of the nursing roles, including dispensing medications to patients. So there's that, and then obviously, it doesn't necessarily you have to come into nursing. As again, if you want to work in a hospital, there's loads of different roles within the hospital that you can do. The one thing I forgot to mention is, so within theatres, so you can be a nurse working in the operating department, or the other course that they offer is operating department practitioners. So operating department practitioners, again, is a totally different course, but these people are trained purely to work in an operating department. So they're trained to work on the anaesthetic side, the scrub side, as we call it. So that's when you're handling the instruments, and the recovery side. But so if you think, oh yes, I want to work, a hospital, please don't think you have to concentrate on the nurse. I need to be a nurse, because there is such a variety of roles that you can do. And as I say, that if you haven't got those grades first time round, consider the nursing access courses.
Okay.
And always think that within, obviously, if nursing was something you choose, again, you don't have to stay in the same hospital that you've done most of your training is. You've got that opportunity to move all over the country or go and work abroad as well.
Which is really good. So for you, you'd say get your foot in the door, have a look, shadow people, see what they're doing, then you'll get a better idea of what it is.
Yeah, because I know sometimes, unfortunately with the media, that you only see about, sometimes we paint a bad picture of things, but actually it is a very rewarding job. So this is me, I'm going to blow my own trumpet now. So I've been here 16 months.
Yeah.
I've had a nomination for a Staff Excellence Award. So these are these awards that we have in regard to the care that you give. And apparently this is like the patients nominate you. And then yesterday I had a nomination for a Daisy Award. So that's just like little things of recognition that give you that feedback that actually, so what I am doing is really good.
Yeah, amazing. Well, congratulations.
So there are, like I say, you can go home, you can have a really bad day, and this happened to me, and you just think, well, tomorrow's a different day. And they do encourage you within nursing to do like reflective practice, that what could I have done differently? You know, and actually I think it is important to do that. And so a lot of the times you think, actually, no, I couldn't have done anything differently. I did the absolute best that I could. And again, the reward is actually, you know, when a patient says to you sometimes, actually, thank you so much for listening to me, you've made a difference to my day. Because I think as nurses as well, patients do think the nurses are more empathetic, and probably because we do have more of that time. You know, I see it myself, the doctors will rush past and have a quick sort of chat on ward round, and I find that I'll have to go back and I spend longer with them talking about things.
Yeah. Is there anything that you'd have done differently over the course of your career? It sounds that you've done.
I don't know, to be honest. I don't know. It's funny. I was asking myself this the other day, and I actually think no, I don't think there would have been. So you know, yes, there's that in my early 20s thinking, oh, should I have gone to work abroad? But actually, I'm glad I didn't. I've you know. So one of the things for me is that, you know, it wasn't a degree profession when I started. So for nurses like myself, we have got that opportunity to obviously do a degree anyway to bring us up to that, you know, the degree level, even though actually sort of clinically, you know, we have got a great deal of experience, but unfortunately we just don't have that piece of paper. So we do have that opportunity to go and do degree modules. So I think I've got, mine's probably expired now though, knowing me. So, but obviously, so the next step for me is actually like looking at, okay, here I am now, where am I going to go next? So actually one thing I'm looking at is, so in some roles they like, which, you know, nurses can prescribe. So I think that's one little step for me as students. So that's a degree module. Or you can go and do master's things in like service improvement and things like that. So, and even for anyone that thought, actually, well, I'm not quite sure, I haven't quite got the grades now. Well, actually, you can start off as a healthcare assistant. And then actually, as time goes on, you're getting that insight into everything. And then actually, you can then, you know, apply to do your nursing.
Yeah, that sounds like a good tip. A really good tip. Are there any kind of materials that you've got that the students could maybe refer to or have a look at, whether that be websites, podcasts, books, courses, just anything?
So I would obviously look at, you know, obviously which university courses are offered. Look at the Nursing and Midwifery Council online, because that is our governing body. So they sort of set the standards that we have to work to, which is priority. I always forget them. So it's like sort of, you know, they sort of say to us, we have to practice, you know, effectively, practice safely, prioritise people. There is a fourth one, and I always forget it. Obviously, sort of look on the websites about different hospitals, and it sort of tells you a lot about that hospital. You know, obviously, YouTube's, obviously I'm old now, but so YouTube and things like that, just sort of, you know, look about, you know, someone might tell you about how to do this sort of thing. How, you know, how do we, you know, how to do a certain dressing. And I'm sure people have put podcasts on about, you know, how they're finding their training. And I admit, so it has been a difficult year for them. It's been quite a strange year for all of us, to be honest. So we've had to get, you know, obviously outside that, you've had to like sort of, you know, teach differently. Obviously people are wearing masks wherever we go now. Obviously we've had to get used to wearing those within the hospital nearly all the time. But you know, just sort of, you know, ignore what you read on social media. I would just say sort of, you know, go to like Nursing Midwifery Council is probably the best one, because they will direct you to other areas, and that will tell you a lot more about sort of, you know, what nursing does. And then, like, you look at the universities, think of an area that you'd quite like to go and study in, and you know, and sort of see what their course is. And if it's something you want to do, you know, you don't necessarily have to think, oh well, actually I live in Mansfield or I live in Nottingham, therefore I'm just going to do my nurse training here. Actually, you could go and do your nurse training somewhere else.
Yeah, the world is a bigger place than your own city.
It is. And then the other I mean, you know, as well, so one of the things I wanted to do when I was younger, I wanted to be a nurse in the army, but then I had to have back surgery, so obviously that just sort of changed the way I did things. But no, so you just, you know, just don't think that that's it. I'm going to train in this hospital and I'm going to stay here and I'm going to stay on this ward for the rest of my life, because you don't have to.
Shop around.
There's so much opportunity. And even some people actually start off doing their nurse training and then go off and become a doctor instead.
Yeah. So there's lots of different options. So explore them in a nutshell.
Yeah, so like I say, you don't have to be a nurse. There's plenty of other things that you can be within a hospital.
Amazing. Well, thank you so much for all of that. You've given a lot of insightful information, and I'm sure it's going to really help the students with their studying and their learning and development. And I'm sure some of them will want to take you up on the shadowing.
That's fine, Nadine.
Yeah,
Just drop me an email and I'll give you my contact numbers.
That would be absolutely.
So I work I work Monday to Friday, 8 till 4. So I'm always around.
Oh, amazing. Thank you so much for speaking to me. I really do appreciate it.
Okay. Thanks, Nadine.
Bye.
Bye.